And good evening, and welcome to iHealth Radio and the iHealth channel. Hurricane H here. Today's talk show is Innovate talk show series, and we have again yet another special guest. As I always say, all my guests are special. I have Joan Melendez, and she's president and CEO of Xcelrate UDI, and we'll know what that is in a few minutes. And again, we'll talk about something that is obviously related to health and healthcare, and more specifically in the health tech and medical devices and recalls. Good evening. Oops, sorry. And welcome to iHealth Radio and the iHealth channel. That is interesting. Here, today's talk show is Innovate talk show series. I'm copying myself here. As I always say, oh my guests are special. That's a new one. I have Joan Melendez, and she's president and CEO of Xcelrate UDI, and we'll know what that is in a few minutes. And again, we'll talk about something that is obviously related to health and healthcare, and more specifically in the. That was just my left feed. it actually came up, so we're all good. That's my studio, channel here. So this is what happens when you go live.
Exactly. Exactly.
You gotta enjoy those moments, like the bleeps and things. It's cool stuff. Anyway, so going back, so Joan Melendez again. She is actually with us right now, live from Seattle. Correct?
I am in Seattle, Washington. Yes.
That's right. That's right. And so again, this is broadcasting right now live, I think, on YouTube, Facebook, Instagram, LinkedIn, a few other places, and also on the radio. So if you're watching, please join in, tune in, and I'm going to try to get some good intel and some good information about this particular aspect of health. And so first, as always, we need to get to know our guest. And so, John, can you tell us a little bit about yourself and your background? Then we'll take it from there.
Sure. Hi. Thanks so much for having me today. I'm Joan Melendez, and I am the president of Xcelrate UDI. We're a unique third-party provider in the electronic health record industry. We actually allow integration easily for the provider, where we sit right on top of the electronic health record and are able to prevent the use of expired, recalled, or adverse event items during surgery. So it makes it super easy for the nurse to document this information. We rely on the medical device barcodes, which was regulated to go into effect back in 2018. And we scan that barcode and we parse 13 data elements directly into the record. So for us, it's all about safety and how could we impact patients so that they are no longer being implanted with recalled items or expired items. I've been in many operating rooms where I've seen both of those handed off to a sterile field and used on a patient. So it's all about prevention and making sure our patients are safe.
Wow. Well, we're going to talk about that because you and I, we've just talked about the case with my mother,
Yes.
and how it all happened with her surgery. But your background is you're working right now with the health and with the OR, but then
Right.
your background is in technology.
Right. My background is in technology. I'm one of those strange adapters, kind of, where when I was younger, I was like, how can I make an impact? What can I do? I would have loved to go into the medical field, but, blood, no, I couldn't handle that. And the operating room is actually very, very clean, unless, of course, there's a huge bloody surgery. But for the most part, they're pretty clean. So, just trying to figure out where I can make an impact and how I could. I'm 58, so when I first started looking into this, EHRs were just starting to come out. So I decided to really specialize in being able to present a really good workflow for nurses in documentation and prevention of use of items. If you really look at any legal cases when they're going into court for healthcare, a lot of it has to go, boils down to documentation, attentiveness of that patient during surgery. Then, a lot of things get called into question. So when you're documenting the use of a medical device, so an implantable medical device, you have to document multiple data elements, the serial number, expiration, the device name. So that all that takes your attention away from the field. And when your attention is taken away from the field, from the surgical field, that's when that's when sponges and such get left in, because you're you're delaying your counts, so the circulator has a very important role in the operating room. So she needs to be able to do the documentation, and she is the ears of that table to make sure if they need suture, if anything starts going wrong, she's listening for the devices to make sure everything is humming along smoothly, because you have the surgeon and you have the scrub at the field who are both sterile, and then you have the circulator doing the documentation and running around and making sure that she's handing off things to the field. And when you're getting delayed and things are taking too long, there's a lot of risk that gets introduced into a case.
So you mentioned EHR as an acronym. So is
Right,
that
electronic health record, right? Electronic health record. People also call them the electronic medical record. When I first started out trying to figure out how I can create something that really would prevent the use of defective items, I started really looking at it as a team. So I had a company called Team EHR, and that really, to me, wasn't quite encompassing everything. I needed to involve the manufacturer, the distributor, the FDA, and so that we could protect the patient, and how could we do that smoothly, by taking advantage of the UDI, the unique device identifier information that's encoded into the barcodes on all medical devices.
So,
and
yeah.
And that regulation didn't go into effect until 2018. So,
well, that's what I was going to ask. I mean, ultimately, there is a background to why this is now the new thing, right? I mean, we've heard about stories over the years, and in movies, people have devices left in them,
right.
to your point,
Bleeding
sponges,
edge,
blades. They get
yeah.
closed and then they have to reopen. And again, I mean, obviously, it's intense when you're in the OR and things like that. Things can happen, they go wrong.
Right.
But prior to technology being added to this particular process, certainly things were not being monitored, or at least not to the degree where you can have it real time and and be able to catch and inventory, whatever it is.
Right. It was all done on paper before, but if we look back when we were on paper, we didn't have all these, that new word novel, these new,
Don't go there.
yeah, but that's the term that's heavily used in the medical device industry, because if you have, like, let's say if you have a Band-Aid, right? And the Band-Aid that you put on the skin has gone through the 510K process at the FDA and has been approved to use as a Band-Aid, you can reuse that 510K process as a novel use. And now all of a sudden you're an implantable device. Your device is being used on the bone internally. It's no longer a Band-Aid. It's something that is retained within the patient's body and dissolves.
Wow.
So, and those aren't being tracked as a medical device when they should be, because they're still being tracked as a Band-Aid. So there's a lot of things going on now, that we really need to look at. We were on paper, less devices, more surgeries, more risk.
So I was looking at some of the recalls out there, and so obviously you're familiar with pretty much all the hot recalls today in the tech,
Yeah.
in the medical. Are there any ones that we should really be looking on and kind of be worried about that we can share today with the audience?
Oh, for sure. Unfortunately, right now we're having to deal with COVID. And unfortunately, we're having to deal with a lot of miscommunication surrounding this disease. Masks, we're putting our healthcare workers at risk daily because 70% of PPE is not effective. When you're looking at an N95 mask, that is supposed to take out 95% of the particles, right? But they're being tested right now between 20 and 70%. That is, and we can't do this to our healthcare providers. And it's because of the, we don't make a lot of the PPE in this country. We haven't for years. It's been made in China. We knew back last year in the summertime that we were at risk at running out of PPE before COVID.
Wow.
COVID hit, we ran out 6 months earlier, right?
And then, of course, they've been using other type of masks that may not give the same or as close as, a good protection.
Right. Well, what we did, one would think it would be that easy, but the government said anybody could make a mask, and can sell it to healthcare providers. They opened up what's called the emergency use authorization, the EUAs. Lots of acronyms.
Well, we gotta learn them all today.
Yeah, everyone will get tested after this. So when we're looking at those emergency use authorizations, at the FDA, they've taken away manufacturers from the list that they are not allowed to sell in the US. But I still am finding these devices, and they're a device, their masks are a medical device. I'm still finding these on ancillary healthcare provider sites for sale for dentists. A dentist, oh my God, they're right in their face. They need that to be 95%.
Well,
An anesthesiologist. Yeah. So we really need to protect our people more, and it's really sad. And, and if you look at the recall of the new, of the items that have been accepted into the US as an emergency use authorization, when you go to look up the recalls on the FDA website, which there are 13 different recall databases on the FDA website.
Wow.
There are also 2 additional different places to look for items that came in through an emergency use authorization. So if you wanted to be proactive to see if you were in danger of something that has been recalled, you have to look basically in 15 different places on the FDA website.
And that's in just standard FDA, just kind of Google,
FDA.gov, right.
Recall items.
Yeah. So we actually, because there's so much risk, not only for the patients, but the healthcare providers, because, when you're vetting a new product, right, you want to be able to see, has it injured anybody else? You want to be able to, when you're introducing that to your family, because your patients in your community, they're going to be family members out there, right? So we always want to make sure that we're taking care of our family. So when we're looking at these medical devices, just like when we're looking to buy a new car, we're looking at all of the safety features, right? So we created UDIclearinghouse.com. And so that is one-stop shopping. So you can go as a healthcare provider at no cost. We are not charging our healthcare providers. They can go look up all of the recall, adverse event information on any medical device. We've mined all the data from all of these different FDA databases and given the providers one place to go look at all these different data sets.
Now, you're obviously an independent company that's specializing in identifying these recalls and make sure that you have them, pretty much broadcasted where people can actually access them easier.
Right. And, and what we're doing is, we're working with the manufacturers and showing them, the FDA site, because, a lot of the manufacturers, they want to do the right thing, right?
Oh,
so
sure.
we're showing them the problems on the FDA website and how hard it is to communicate. And then, of course, they know this. They know how hard it is to manage a recall. I mean, you look at Allergan, the breast implants, they're missing 50,000 patients. How does one do that on a recall? So they are trying to identify these women and they can't.
Because there's no
So
trace, or because there's no record, or
because
because it
there's
was all
the
manual?
traceability, it's not been an important part of anything. Who knows what a UDI is? Who knows what a unique device identifier is? You know what a FIN is? I mean, I'm sorry, not a FIN, a VIN. You know what a VIN
VIN,
is?
yeah. Well, so that this is the equivalent of a VIN, but for,
Yes, yeah, exactly. A
pretty much,
UDI,
yeah.
yeah,
So
unique
every
device
item
identifier.
that is created or being manufactured for the health
Yes,
field will have some sort of a code that is integrated in
right,
their barcode.
right,
And so whether it's a denture, type of, like an implant or body
exactly.
implant, knee, I don't know, something.
Exactly. No, 2018, all implantable devices now have a UDI barcode on the packaging. There's three different agencies, three different looks to the barcode. We actually also developed a free learning course for nurses and doctors. Again, it's, how can we educate the masses? We're giving away a lot of product, but it's for the better good of being able to present good information, accurate information,
Of course.
and to protect our mamas and our
Now,
papas.
now you guys specialize in the servicing of this information, or the actual barcode themselves and the creating the UDIs in conjunction with manufacturers?
Yeah, so what we do is we're super unique in that we are able to work with any of the EHRs, so Epic, Allscripts, Cerner, and our application sits on top of theirs in the operating room. And when a nurse goes to document that in that electronic record, all they do is they scan the manufacturer's barcode, and our application reads that data. And then if it's expired, we present a warning saying, whoa, stop, it's expired. Same thing with the recall. Do you see the warning in the background here? This is
Yep.
exactly what it looks like. It actually makes a sound in the operating room. The scanner vibrates. So if there's a major problem, we don't want them proceeding. We give them all the warnings. And so with that being just, sitting right on top of the electronic record, we put all that information, we parse all that information into the record. We also validate it against the FDA's Good ID, which is the website where all manufacturers have to record their medical devices. So medical devices now have to be with this unique device identifier. They have to have that barcode on the package. They have to have what's called a human readable component. So, with GS1, there's a 17 in parentheses, which is the expiration date. And then they also have to report to the Good ID. So we look at the Good ID and we bring back all those data elements that are required as a certified electronic health technology partner. So with the data, we're able to actually even, we had an instant where a patient traveled 3 hours. It was a child, traveled 3 hours to have an MRI, got to the hospital 3 hours later, was rejected because that kid had a medical device implanted that had metal. Whenever there's metal with an
You can go
implant,
MRI. Yeah.
MRI. If it's MRI unsafe, MRI conditional, they turn it to a CT and they do different kind of imaging. So it's a big deal. So that patient was sent bye-bye because they didn't have that device that they needed to, use on the child at that location. So, if we're able to scan these medical devices right at the point of care, we're getting all this great information. Again, we're preventing expired or recalled, and we're being able to present the nurse in the room. Does this have latex in this? Because you never know. It could have a little tiny component of latex. So we'll be able to point that out. Can the patient have an MRI? Once that patient has surgery, how is the next place going to know that that patient has a medical device that has metal? It takes MRI departments, radiology departments 3-4 hours to vet their patients before coming in. Wouldn't it be nice to just be able to have a scanned list?
Well, so you mentioned about like the instance of the OR and the nurse. Now it sounds like the device and the alarm or whatever that sounds, as well as the messenger, that's more of a fail safe that they're already there.
Exactly.
last minute something happens. But now, is there any pre-steps, to certainly it'd be ideal to have that problem, prevented from even beginning.
Yeah. So wherever they're scanning the medical devices, ours is, we build the case carts with our device as well. They can do inventory with our device. Again, ours is really simple. There's no build. A hospital can go live in a matter of days with our application and really see a significant amount of return on it, not only from looking at what they have in stock and what their expiration dates are, because a lot of times, it's not like the grocery store where people are really careful about putting it in, the last one in.
Yeah.
You know what I mean?
It can be just somewhere in a box, that's it.
It could be in the middle. I
Yeah,
found expired items right in the middle. I've walked out with bags, those big black garbage bags full of expired medical devices.
From,
I have
from hospitals?
Yes, I have 2 big tins right here full of them that I use for testing.
Wow. Well, so question. I know you mentioned 2018 was when the regulation actually was implemented, I'm assuming.
Yes, right? Yes.
Now
that was on the manufacturer side.
I know. So you'd sound like you're like, oh my God, right? So
yeah.
2018 is only two years ago, but
yeah.
This is not new. Obviously the problem has been in existence and technology is not fairly new, but I think it took all this time to get it, passed legislation and implemented.
And we're not there. We are so far not there yet. Yeah. So in 2018, it went into the regulations for UDI went in for the manufacturer. So technically, the way it reads is the manufacturer is responsible for that medical device from manufacturing through disposition. What is disposition? Use, waste, expiration. Do they ever know those 3? Never.
So let's say that we use, waste, expiration.
Yep. Or recall.
Or recall.
So, that's the manufacturer is really responsible for that. But in practice, they do not know any of that.
So who is there?
They know what they sold.
Sure. And they have the inventory and all that. But then again, you got, is there a secondary market for products that can still make it to hospitals and clinics and so on and so forth?
Oh, well, the problem is, when you look at the lack of real, it's regulated, but it's implied, right? My biggest thing is this is right there. It says it right there in the FDA. It says, how it's supposed to be tracked, but it's on the healthcare provider to also track it. So in 2019, the
Here
CMS,
we get better.
Yeah. CMS.
Oh, my dear friends.
Said that you have to parse this data into the record. And in the future, we may increase data elements and we're going to want it on the claim in the future.
Oh, so but because
it's in the future, even though there's a regulation by the ONC, the Office of Natural Coordination, which is another government agency, saying that.
First time I hear about them.
Oh, yeah. So they're really important. They created the interoperability. Have you heard about that? Promoting interoperability?
No, this is exactly what today is about.
Yeah. So there's so much. Oh my goodness. Promoting interoperability is super important. It used to be called meaningful use. Everything has to change because we have to get people to, adopt. So meaningful use, which is now promoting interoperability for the operating room, went into effect really in 2019 for the implantable device list. And that's where these 13 data elements that if you're certified, you're supposed to be able to parse forward facing to the patient. I can tell you that we are the only ones that do all of those data elements. We go from step 1 down to step 5, and we are able to satisfy and pass every single one of those actions. The problem is certification is self-attesting.
Oh, that's easy. I'm just being funny about it.
Yeah, no, seriously, it's wild. We made sure our application does do all those steps. using the devices that are out on the market in the field at hospitals. So, but a lot of the major EHRs on the market do not do the full, everything that's said in that regulation. But what they tell their clients is it's not measurable.
Okay, for whatever that's worth, right?
Yeah, exactly. So meaning, hospital, document however you want. Until you get caught, they're not going to do anything. And then they really didn't say what they're going to do. So it's not measurable at this point.
Well, I mean, like I'm familiar to similar processes and how things happen over time with legislation. I mean, in the insurance and the managed care, I've seen it kind of evolved over the last 30 years. And, I'm pretty sure as this, evolves in the future and, there's more technology and more involvement, it will get better and better and better. And they'll get to a point where it becomes real, like, state of the art and like you can't miss. But until then, you're right. I mean, it's going to be what it is. I mean, it's going to take time.
Exactly. And that's where, we come into play and, we're able to satisfy that major hole in the market, and then we're able to also prevent, when they're using a device in the field. The other thing that we do is, let's say, and this happens, unfortunately, too many times to count, where a device, a stapler, for example, will misfire. You want the manufacturer to know about that misfire immediately, because what could it be? In the last set of recalls, it was where the teeth were misaligned because of a machine that they were able to trace back to a lot number. Had the hospital been able to immediately notify the manufacturer of these misfires or these problems, they would be able to start looking and resolving these issues much faster. So that's the other thing our app does, is not only do we prevent the use of the item, and we parse all the data when it's a good item, because most of the time it is good.
Oh, yeah, sure.
So most of the time it is good. So
1% is plenty.
Yeah, exactly. So when there is a problem, they're easily able to just communicate that on, because they're not doing the work. Our application does in the background. They answer 2 simple questions, and then we send it off to their risk management team, and also the FDA, and also the manufacturer.
So it notifies all the parties, and then basically the documentation is made,
Right.
and then next steps will.
Right, in real time. So that way the manufacturer can start looking, hey, we're starting to get way too many misfires on this device with this lot number. Let's look at the machine and see what's going on there.
But now, I mean, we're talking about just in the nation, 50 states, some other outer, islands, and a lot of devices in all different, areas. And it could be in a DME, it could be in a doctor's office, it could be anywhere. So
yeah, and
how does that inventory control happen right now?
Yeah, so it's everything's manual. Everything's so manual. But in the doctor's offices, they're really not doing as many implants. Yes, they need to check to make sure that their items are recalled. So one of the things that we're doing with that UDI clearinghouse is we're going to allow a provider to upload their items, just to do a check against all of the recall data, all of the adverse events. We've opened up our application so that if a hospital is trying to vet that product to bring it in, they're able to go to one place to look up all the adverse events on that product or that medical code. Because if it's not that product they're trying to bring in, maybe they're trying to bring in something that is made by multiple manufacturers. You know what I mean? Mm-hmm. So they can go one place to UDI clearinghouse and look at everything to see if it's been recalled or have any adverse events.
Now, you mentioned earlier, we were talking about the masks, right? We talked about a lot of them were produced overseas. Now, I'm pretty sure that goes along with other, type of implants and things and devices used in the US.
Yes. If you really look at the most of the medical device manufacturers, some of them used to be in this country are now really have a lot of their manufacturing in China. There's Sweden, Israel, it's all over the place. That's why, when we're scanning those medical devices, we're validating that manufacturer. We're validating that that manufacturer is authorized to sell that device in the United States. I had one the other day where the rep for this one manufacturer was so upset with me. He's like, "You're telling the client wrong information." I'm like, "Okay, let's do this. Why don't you go and grab that medical device? It's a guide wire. Like, grab the box for the guide wire. I have the labeling here, and let's compare and let's read the label together."
Yeah, you went really hands-on.
Yeah, so he did, under his chagrin, he did not want to, go through this exercise with me because it's his product, so he knows his product. I said, "Okay, now flip over the package. Look at what it says. It says it's made for your company, made by this company and this other company." And he's like, "Well, I didn't know that." I'm like, "Well, it's your device. You should."
Wow, oops. That's a big oops. So the question then, products come, like you said, from all over the world, and
Yep.
they are basically imported in, to the US. So certainly they go through the, I guess, the customs. And is there a protocol there that actually kind of tracks anything at that point, or no? Until they make it to the actual hub, and then gets distributed, that's when they get basically inventory,
They come in packaged and already sterile when they're coming into the States. So I don't know about that, how they actually do all that, but I do know that they're already, in the sterile packaging.
And then once they're in, how do they get, I guess, logged in the US in terms of like,
They log them out from wherever they're, because it's the company that's selling the medical device into the US. So they're logging them out, they're tracking them, through their inventory process until it gets distributed to a distributor or to a hospital.
And then they'll get their inventory and then they install it. But they have now they do with the UDI and the ability to actually scan and against the FDA regulations and all the different
I
guess
but only if they would do that. But yeah, so in our future world, we'll be tracking that down to the lot number, because right now, when there is a recall, if our clients purchase that item from the medical device manufacturer, I'm able to trace the exact everything. If the hospital bought 100 items, right?
Mhm.
I should be able to account for those 100 items. When they buy it through a distributor, I can't account for those items because I know how many I bought, but I don't know how many of what lot numbers were involved in that purchase. So we're still missing so much information when we're not buying something directly from the manufacturer.
So let's just, if you don't mind, Joan, just give us a little bit of a very easy step-by-step, we'll take one item, let's say manufactured locally, and how does that transit in a timeline to the manufacturer, from start to finish, if that can help.
Yeah, so I'm not an expert on the manufacturing side, but I can tell you what how I've talked to my counterparts in the manufacturing field. They basically, there are some in the States that are made here locally. So if they're made in the States, they just do all of their sterile stuff, throw them in a box, everything's sterilely wrapped. The UDI is attached at that point when they're during manufacturing, after it comes out of the steriling process. And their packaging is all designed well prior. It depends on the device. Some devices are serial number driven, so that means there's only a one-to-one relationship. There could be a lot number where there's a many to one. So that's identified all on that packaging, right, when that's being created. Then it sits in a warehouse until it's sold to a hospital. And when it's ordered, so in the event of a total knee or something like that, the components are ordered from the hospital and then they're shipped out. If we're using one particular manufacturer that I love, which is Johnson & Johnson, actually, they have a really good tool that allows you to really trace everything. So I know exactly down to that lot number or down to that serial number, what was shipped, when it was shipped. But not all systems are like that.
Well, we hope that soon and soon enough, right?
Yes, exactly.
So earlier, you and I, we talked about medical records, and I think you mentioned about the EHR and stuff. So
Yes,
what should be on the medical record other than,
yes,
just the basics? I mean, in terms of this is
right,
relevant only to all implants or any devices that are being given to the patient or the patient pretty much.
right. Well, we're circling back down to promoting interoperability. So what's required now by law is that you have all of your record that is interoperable, so that if you go to a hospital out here in Seattle and you come to visit me, everything from your New York hospitals are
Sure.
easily accessible. So that's what you should be doing. And it should be, if you're using an implant, it should be based on the interoperable, the
Platform.
interoperable device list, implantable device list, sorry, the
So
implantable device list.
so
So,
then
and
it's
then,
actually accessible across the board at any
yes,
particular location in the
yes.
States.
Yeah, every patient, the minute you're discharged, you should request your records. You should know what was documented, not just what was verbally told to you. I always tell my friends and family, I'm a nag. I am a naturally born New Yorker, the naggy Puerto Rican. Make sure that you get your medical records. It's so important because you want to know what happened. If you start having fevers after, a surgical event, why? You know what I mean? Could it be because maybe they left a sponge? Maybe the cement was recalled, and that's one of the adverse events that they look for. You need to be, be your own best advocate. And again, that's why, with UDI Clearinghouse, we're able to, help the providers, but we're also working with those adverse events so that if a patient has an adverse event, we're really recommending that they use another application called Track My Solutions and go register your medical devices with them, because they will help track your medical devices, and it's free for the patients. So, it's all about how can we protect our patients.
Yes, right. And again, that is, I mean, the forum here and the platform is about, education to the public and the patients and in the healthcare. And this is obviously a big thing. The reason I was laughing, because when you said you have to get your records right away, I laughed at myself because I find out my mother's records 7 years later. So
Right?
or 8 years
Yeah.
later. So just take it from me. Take her advice. You need to do that right away to identify
Yeah.
the issues. Otherwise, it's too late. At the point you realize something went wrong, and luckily, in my case, there's no, it was not that, dangerously,
Right.
extreme. But everything went well. But for some people, it could be just life threatening. It could be something more serious that can just be not fixable in
Right.
short. Yeah.
Right. I mean, look at the breast implants. 3 more women have died. They've been reporting um, uh, adverse events really heavily since 2011. And the FDA on their website used to say that after a few, we'll go ahead and research this, but they've removed that verbiage. So, how can we, protect, um, you know, vulnerable people? Because, they're coming out with what's called a black box warning now on breast implants. But who's going to see that? The doctor. The patient is rarely going to see that black box warning. And the doctor knows the risks with medical devices in patients.
Well, I mean, it's a foreign object that's going in your body, so there's always a risk.
Exactly.
But
Exactly.
so you do know that your body can reject it. I mean, that's
Exactly.
the
You can
simple fact.
have a different reaction. Like with me, I would keloid up. I could not have anything foreign going into my body because my body just doesn't like anything. I can't even wear earrings. So you
Well,
have to see, how your body is. Just because it's good for one person, it's not good for another. Love yourself. Take
well,
care of yourself.
not true, but typically doctors will, request all the different medical clearance and from the primary doctors and any history. But again, that's not 100. No doctor is going to give you 100% guarantee. That's a fact.
Right. And it depends, some surgeons, are surgeons.
Well, again, but when you go to surgery, you do sign a waiver. I mean, there's always a lot of stuff that can go wrong. That and again, they do their best, and we're not
Yeah, they
taking.
do their best. They do.
They're gonna do
Yeah.
their best to save life. They're gonna do their best to get you, but they will never guarantee everything because again, it is not something that they made themselves. It's purchased, it's available. It can
Right,
save your
right,
life, or sometimes, in rare cases, it can be a problem.
right, right.
But the
Even
idea
those
is,
ports, when you're talking about access ports,
mhm.
the vascular access ports, the cleaning and the care that has to go around them and the reporting that should be going back and forth. Again, that's why we're working with Track My Solutions so that, we can have patients reporting even that type of an adverse event so that they can notify their doctors much quicker and notify the manufacturers that is it a problem with the patient or is it really a problem with the device or a reaction to some new plastics that they're using in the device, because you never know.
Now your service is obviously public, I'm assuming. Well, it's a private company, but it's servicing everybody. The access, the data, and all the stuff is available. Now,
Yes.
you work specifically with the providers.
We work with the providers and the manufacturers. So what we do with manufacturers now with UDI Clearinghouse is we help them clean up their data. Because if you look at the FDA, the 13 different recall databases on the FDA, if you look at the days from initiation, so when the manufacturer originally said that we're recalling this product, how many days is acceptable to be posted on the FDA website?
Oh, I have no idea.
Yeah, so it should be like, like food. Food is within 24 hours. Not so with medical devices. Averages a few months before they're posted.
Which means they could have been used in so many other,
So
patients.
many times, right? Because a lot of hospitals rely on that posting to the FDA database. Yes, the manufacturer did send out a warning to the hospital, but sometimes it's sent to the wrong department and it's mailed. There's no
Or they
electronic
can say,
notification
yeah.
of recalls right now. Ours is the first one. So with UDI Clearinghouse, we're working with the manufacturer so that we can immediately notify hospitals of the recalled event. That's why we're offering the application to hospitals for free. All they have to do is sign up and they're able to get instant point of care or real-time care notifications of recalls instead of waiting the whatever amount of time that it takes to get posted.
Now, you obviously just not service only the US, you international.
Yes, yes,
So
yeah, we're
how does it work with the other countries that you guys service in terms of this? And does that communicate with our database in case, let's say, a US citizen is traveling and they do some sort of a transaction there and they have a last minute emergency implant or something, right? And
right, right. As long as, and that's why we wanted to, how can we again protect the patients internationally? Patients need to be their own best advocate and they should sign up with Track My Solutions, and anything they have implanted, they should record. Again, if you get your records immediately when you're somewhere else, if they're not, part of the promoting interoperability, you can at least record your medical device information on that platform, and that lives with you. So, and again, these medical devices are sold internationally. So though there are different regulations now coming into play on unique device identifiers, in the EU, in the UK, just Canada, everywhere, we do have that one common thing, the medical device identifying number, and we're able to use the different data sets internationally to see if it's been authorized for use in that country as well.
well, I mean, in a way, it's very using the same concept of like when you said barcodes and UPC codes and things like that. I mean, those are
Yeah.
unique identifiers for products, but in this case, it's specific designated to devices that are medically necessary for implants.
Right, exactly. UDI, unique device identifiers. A UPC is more like something on a Coke can.
Correct. Yeah,
And then we also have the UPCs on the medication.
that's right. So the app itself for the patient, well, it's not an app. When you say they have to register in the care solution, is that?
Yeah, so it's Track My Solutions.
Track My Solutions.
Yep.
But
It's a
it's a
way
device
for,
or an app.
It's an app. It's an app for your phone. I love it
That's
because
what I
it's,
was asking. Yeah. So it's basically everybody can literally download that and have it, just especially if they're gonna undergo some sort of a surgery or some sort of implant, uh,
yeah,
or have any device, in their body. Now these
right.
devices can go from a cataract, I'm assuming, to
Anything, everything, whatever you have that's foreign in your body should be recorded, including a bullet. Seriously, if you have a bullet in your body, that can cause problems when you go to have an MRI. You
Oh
know,
yeah. Well, believe it or not,
so
that may be a case. Some people are, they do live with those. So
yeah. Some of our veterans, unfortunately still have shrapnel in them. So
yeah.
yeah, but in this way, again, if you have that device registered, you're going to go for an MRI. You can go to your phone, look up your devices, and go, oh, this says it's MRI conditional. I should tell somebody about that. You
No,
know,
no, is there I know we kind of asked this a little bit earlier, but so there's no one really going, from one hospital to the other and checking all the inventory, like doing like audits and spot checks and things like that, just random. So there's none
no,
of that.
no. I'm
Wow.
probably the only one that goes and does that, to be honest with you.
But
I
you're
do a
doing it
lot of,
because as part of the connection, you're trying to get them all to adopt the.
yeah, I'm just trying to show them, how powerful this little tool can be.
Good. See, that's good.
And
We can display that. Yeah.
and the beauty with the way we've programmed it is they can go in and do a complete, what they call the internal core of the operating rooms. They can scan all the medical devices in that core in a matter of you know a few minutes to hours, depending on how much inventory they have, and be able to get, produce themselves a really nice list of everything that includes expiration dates. That, they'll be able to pull the items that are expired. They'll be able to pull the items that are recalled, all by just going in and scanning. And right now, because of COVID, we're offering our inventory module for free to any healthcare provider so that they can make sure that they're protecting themselves and their staff and their patients.
That's all hospitals.
Any hospital, all they have to do is contact us. We have,
Actually,
the module that we, use in the operating room to prevent the use of recalled and expired items and parsing the electronic record. That's what we sell, but we're able to give away some of our products in order to help us through this time as well.
And do you guys like interact with? I know you interact with the provider side. Do you also interact with somehow the payer side, insurance companies?
We actually should, right? Because one of the things that we do, because we're scanning every single thing that's going into the patient's body. So when they're doing their nursing documentation and then they scan all of the items that they're using, and even the items that they're opening to the field that they're using for the surgery, they can scan all those items as well. And then we can produce, an itemized use report on every case. And, and again, since we're sitting on top of the EHR, it's putting it in the medical record. We're able to, at the point of care, at the time of service, give those important reports to the supply chain staff and the charging staff so everybody knows what's going on. We're able to identify when items aren't part of what's called the item master, so it's not part of their inventory. Let's say a rep brings something in that they've never used before. How do we know about that? We know about that usually 3 or 4 days later when we're already past billing and trying to figure out how to recover that $6,000 bill that we just got at the hospital. So we're able, by looking at those scanned devices, and it's easy. We're using the medical device manufacturer's barcode. We're not putting anything on. That's why it's so easy for our application to go live so quickly.
Wow, that's a lot of information.
I know.
I'm still trying to get a handle on it, but the good news is this is all live and recorded, so we can always listen to it again and just kind of absorb it. I think the second, third time we might catch more of the details, but
and we can always have another conversation.
That's right. That's right. You're always going to be welcome on the show. And any last advice? I know you've talked about, get your app and make sure you register anything that you ever get your records. What else?
Yeah, get your records. Always get your records. Be your best advocate. Stay safe. Wear a mask. Please wear a mask. They do save lives.
So how
But
can, I'm sorry, go ahead.
no, go ahead.
I didn't mean to cut. That's a big important topic. So finish it up.
Yeah. So, but again, when you're wearing a mask, if you're wearing a cloth mask, the best way to test how your mask is really to try to see if you can blow out a candle. If you can blow out a candle, that mask is not really doing much to protect you.
Well, you said
So,
the N95s are still not 95%.
yeah, so, and then look, and you have to go to our website, UDI Clearinghouse, to see, where you can go see a complete list of everything that's recalled. If not, you'd have to go to the COVID section for some COVID stuff, or the EUA, the Emergency Use Authorization component, to see if items are there that are recalled. They're not in one place. That's the danger. And just, stay distance, 6 feet apart. I had several exposures this last week because I was in an operating room. So, again, hand washing, take care of yourself, take care of your family and friends by wearing a mask, hand washing.
Thank you. That's a very important, I guess, advice, especially the cases are still around, then COVID is not over with yet. And we don't know how this winter is going to look like. So, again, the risk is still real, and,
Yes.
we just have to do the due diligence and make sure that we follow the basics.
And then if you do get admitted, make sure you get your medical records. Always, after any admission, get your medical records so that you can read and see exactly what happened to you, so that you know if you had a partial removal of something or a full removal. Because it's you'll be able to see, why am I not recovering as well? If they missed margins, I had a friend who had some cancer removed, and they ended up nicking the margins, and she ended up getting more cancer because it's spread. So you always want to get those medical records.
Wow. So for our providers out there, if they wanted to, I guess, reach out to you and kind of be part of the network and have access to your devices and technology, how can they do that?
They can reach me at joan@xcelrateudi.com. It's XCELRATEUDI.com. And, we're there for you, providers. We're a phone call away. I love to talk. So we'd be more than happy to, walk you through, even looking at your medical devices and any, vetting process that you're going through, or any recall processes that you need to strengthen. We're definitely there to support you.
Well, Joan, it's been real. It's been informative.
It's been a pleasure. Thank you so much for your time.
I hope that the audience has enjoyed, the content, the fun, and really is taking this, as a real, fact that most of us would not even think about on a normal day. But not everybody is going with an implant, but you never know when you're going to need one, or someone in your family is going to have some sort of an implant in their body. And,
Exactly.
listen, to your point, it could be a cataract, it could be a dental implant, it can be a
Anything.
crown, it can be something that is.
It can be a port, where you're getting medical medicine in. Look at our kids, that are going through cancer treatment. They have medical devices implanted.
Oh, really? I see. I had no idea.
Yeah.
So again, it could be a lot of cases. So the key here is be aware. Again, you have all the information on this video. I will get some more details from Joan in terms of, the contact information, put it on the site. So, and on the videos, information. So again, you have access directly to her. She's and her team. They're available. It's a great, service, and certainly does great for people and could save lives in a
Yes.
nutshell.
Yes, we have saved lives. Yeah, the item that's behind me was getting handed off into the field. It was cement. You can't take cement back out. So
like this is like a human cement type of thing, like in the body.
Yes, yeah, definitely.
Wow.
Yeah, a recalled item. It's some can't be taken out.
So what happens to a person that has that? I'm sorry, we just.
Yeah. So no, so it's a recall device. Sometimes they just monitor these things to see if you're developing any of the symptoms. But because it was recalled, and they scanned it on the way to the field, it was just recalled that morning. So we were able to prevent it from being opened.
Oh, okay. So you caught it in right in time.
Right in time.
But whoever had it before, it's too late. There's nothing you can do.
No, yeah.
Oh, wow. Okay, see that's a big deal, and you know that
Yeah.
it's a good thing that we close with that one because I didn't know
Yeah.
about that, and I'm sure anybody that's watching this episode here would not know that
Yeah.
there are devices that you cannot take back. I mean, even if
Yeah.
you
We can have a whole nother segment on recall devices, and maybe we should.
we should. Yeah, listen, I'm down, and I think we'll definitely have more room for that. Yeah, so let's lock that one. We'll talk about another session, and we'll talk a little bit more of other pieces of the discussion here, and maybe we can just maybe list some devices and what they do and what to look for, so people that may have some of these procedures know that they have to higher risk, at least know the risk before you go.
Exactly.
So,
Exactly. Yeah. I mean, one more thing. It's just like when you're going to have a new knee implanted. Are you having that, whatever the doctor is using, is it because it's something that he's used to using, or is it because of your activity? There are different knee systems. So
sure.
what's the best one for the patient may not necessarily be the one that the doctor is familiar with using.
Because they pretty much have been only approached with some devices with some
Right.
I guess medical device companies, but not maybe others.
Yes.
I mean, I'm
Yeah.
assuming doctors also do some due diligence to identify what's the hottest stuff, especially if they specialize in like let's say knee surgery and things like that. They would know, but to your
If
point,
they're allowed to, some hospitals are restricted by their purchasing departments.
oh, that's right. I forgot. I mean, I'm thinking more like of an individual doctor who does this, like maybe an orthopedic,
Yeah.
surgeon, as opposed to your point. If you're in a major hospital and you're the hospital doctor that you just basically a salary doctor, you're not going to have any information on that. I mean, I'm
Yeah.
certainly they do conferences and trainings and
Yeah.
things, but well, again,
Yeah.
again, for all providers watching or listening, I mean, it's if you didn't know, this is an opportunity to maybe reach out and learn about how to get better at it. And if you did, I mean, that's great, and hopefully that there will be no issues, and that's it. So, Joan, thank you.
Thank you so much for your time.
We've spent almost an hour just about, and that it's been good for me. I learned a lot, and I hope that again, the information is out there, and it will be uh, replayed so people can really get access to it. We'll definitely have a second come back and discuss more, and maybe we'll discuss more of the breakdown of the session. Today was more of a generic, general discussion. So I'd say thank you. And for you, audience watching listening on the radio, thank you for watching. Thank you for listening in. And we'll be talking soon. Hurricane H here. Have a great night. Bye bye.
Have a great day.